Dr. Rabinstein is going to be talking about a challenging issue that he's authored numerous publications on, what is called paroxysmal sympathetic hyperactivity after brain injury. Please welcome Dr. Rabinstein.
Well, thank you all for coming. I'll try to convince you that this topic pertains to anybody working in, I would say, ICU in general, certainly neuro-ICUs, even if some of you may not have heard of the problem or heard of the problem by this name that has become sort of the standard name in recent years. So I have no pertinent financial disclosures, although I would like to have one for this topic. Why this is a problem that we should all know about is because it is actually relatively common. If you see patients with severe TBI, it may occur in up to a third of those patients. If you see patients with brain anoxia, for example, after cardiac arrest, it is not very common, but in severe cases it can occur and it can be very refractory. It is a problem that is more common in younger patients, so it is the patients that you are going to be full force in terms of treatment. And very importantly, it is both underdiagnosed, unrecognized, and misdiagnosed. And it can be misdiagnosed throughout. So not only at the beginning and then you realize that the problem is this, it is misdiagnosed, leads to a bunch of tests and treatments that are inadequate, and the problem stays. One of the problems with this topic has been not just the lack of attention in the literature, but also the fact that the attention has been divided by various nomenclature and diagnostic criteria that lacked uniformity, and so it has been a problem that has proven difficult to study over the years, and a problem that for the most part for many years was relegated to the rehabilitation literature. So the literature for many years was messy, among other things, because of the various names with which this condition has been known. Some of those names are overtly incorrect, like calling it diencephalic seizures. They are not seizures. And some were either too non-descriptive, like dysautonomia. There are many other forms of dysautonomia,